Hey guys, I'm Dr. Ruth Roberts, creator of the original Crock-Pot Diet, coming to you live today on a lovely Thursday. It's crazy storms rolling through. It's 62 degrees in Charleston, South Carolina on the 8th of June when I woke up this morning, which is just bizarre. And I'm sure everybody's seeing all of that. But that's not why you're here, to talk about the weather. So what I wanted to talk with you about today is gut health, and I touched on this briefly when we were talking about cancer last week. And ultimately, that's one of the cornerstones in functional medicine, as I started talking with you about. And what that means is that what we're just beginning to understand is how important the gut, and actually more specifically, the gut microbiome is to our overall health. And so if we kind of step back a second and break that down, there are something like 13 trillion organisms per gram of stool in the human body, and there's probably some better estimates out there now for dogs and cats, but let's say it's something on the order of, say, 9 trillion. That's a lot. And what that means is that these little organisms are not us, but they are us. And so there's this idea that self that's not self. So if you look at so much of our cellular structure, the most important organelle, if you will, within a cell is called the mitochondria. And the mitochondria is literally the powerhouse of each of our cells. That mitochondria, the thing that's fascinating about it is that the DNA is not human, it is bacterial. And mitochondria are present in all mammals' cell structure. So it's something that we evolved with, if you will. And the mitochondria are so vitally important to our health, it's just unbelievable. So taking that concept of self and not self, certainly mitochondria are part of our cells, so that's part of ourselves, but actually not. So they've become incorporated in our body. Same thing with the gut flora. They are not ourselves. They are organisms, single-cell organisms, that are responsible for many of the processes we take for granted. So certainly they're important in digestion, the ability to assimilate nutrients into the body, the ability to break them down into pieces that we can actually deal with. They are also important, they're considered to actually house, the GI bugs are considered to house 75% of our immune system, which is just bizarre. So we think of our immune system as the lymph nodes, the spleen, the white cells, the various, T cells, the natural killer cells, and then all of the little molecules that direct where these cells go. But in truth, 75% of our immune system is created and operated by probiotic organisms, or our microbiome, if you will. The other thing that's so fascinating is that something like 90% of our neurotransmitters are produced in our gut. And they actually never go here, they never go to the spine, they stay locally in the gut, and they direct how things behave. So the microbiome is so critically important to our health, and we are only beginning to scratch the surface of what it does. In the human literature, so I take a subscription to the New England Journal of Medicine's online roundup, and the papers that are coming out in all disciplines, not just gastroenterology, but psychiatry, cancer medicine, liver disease, kidney disease, everything. There are papers coming out every week about how you can manipulate the microbiome to improve a particular disease within whatever that discipline is. So for instance, there was an article in the psychiatric journals about using 2 prebiotics. And so these are substances that actually feed the probiotics. FOS and GOS, so fructooligosaccharides and galactooligosaccharides. These are complex sugars that we often cannot digest and cannot utilize, but the probiotic organisms can. So the thing that was awesome about this study is that using just an FOS and GOS supplement with no probiotics added into these people's diet improved their anxiety and their depression. That's tremendous. And what's more is that it did so in such a way that was equal to many of the antidepressants that are being prescribed today. That's insane. Two little, complex sugars that we cannot even absorb into our systems. It's just nuts. That's just crazy. But that's the thing. That is the power of gut health. And so it's a multitudinous thing. It's making sure that you've got the right organisms on board, that they're in charge, and that you're feeding them the right thing. So there's, if you look at things like Clostridium difficile, which is a dreadful bacterial infection, that in many cases for people that are older or sick, that can actually kill them, and especially if you've acquired it when you were in a hospital. So I had C. diff for the third time this winter, which was just lovely. And my gut's still kind of iffy. And so the deal is that even though I was taking probiotics, the thing is that stuff was leaving my system so fast that they really couldn't get a hold. And then once the symptoms slowed down, they still weren't doing that well. There's a company on the human side called Genova that does stool testing, and they can tell you exactly which probiotic organisms are doing well in your gut, how many are there, that sort of stuff. And then also if they're producing enough short-chain fatty acids, or you're producing enough short-chain fatty acids for them. And so that was the interesting thing. And I think, we don't have this type of testing available for pets. But the lesson here is that I had some probiotic organisms in my GI tract, but they were not getting the food source that they needed in order to thrive. And so it's not just taking the probiotics, it's taking a diet that gives them the nutrients that they need to thrive and survive, and ultimately to help you. So that's where high fiber vegetables are so important. And then things like resistant starches, like potatoes, for instance, red skin potatoes, if you cook them, boil them into little chunks and then put them in the refrigerator, they actually, their starches, much of it goes into resistant starch. And the reason that's important is that, again, it's not for us, it's for the bugs. And it tends to select for the bugs that are going to make your gut healthy and incidentally help you lose weight. So that's the thing that's so interesting. We've been focused on just, add probiotics and they'll all go away. Well, it doesn't quite work out that way. So that's why gut health is just becoming this huge burgeoning field on the human side. And ultimately, it's going to be important for our pets, and how we end up doing that is where it gets a little tricky. So gut health, what does that mean? So it means that you're able to eat food, have it go through the GI tract and be processed appropriately, and that means from the head, literally the head down. So digestion starts when you see food, and it does for dogs. You're making food and they're sitting there drooling. That means that their digestive processes have already started, and they're beginning to produce lots of saliva, so they'll have salivary amylase, which is a molecule that helps to break starches down, and that also has turned on a mechanism in their head to tell their stomachs to start producing hydrochloric acid, and also to tell their pancreas to start producing the rest of the digestive enzymes. So that's kind of the first step. Step number 2 is chewing. And so for dogs and cats, we're accustomed to feeding them this kibble, which many of them don't actually chew. They just sort of plow into the bowl and start chowing it down, and literally they're just swallowing this kibble whole. So if you think about this for a second, if you take a piece of kibble between your fingers and try to crush it, can you? And the answer is most often no. And in fact, you probably need a hammer to crush it. So think about that going whole straight down into your pet's stomach. It's going to sit there. And in practice, we would to get ready to have an animal come in for surgery, whether that was for some getting their teeth cleaned up or tumor removal, what have you, we ask the clients to fast their pets for 12 hours prior to anesthesia. So that means that pet last ate at, say, 8 or 9 o'clock the morning before at the latest, and now they've come in for anesthesia, we're doing their workup, we've given them some medicine that sometimes makes them vomit, and boom, there's all this undigested kibble sitting in the cage, and no kidding, this animal has not eaten for 24 hours. Wow. So how is that going to, if it's still sitting there undigested in the pet's stomach, how is that going to actually get digested as it moves through the GI tract? And the answer is not very well. So they're bolting the dry food down. That means that they're not making digestive enzymes very well from the pancreas because they haven't chewed it up, and it's in a form where it's just difficult for them to do any digestion, which stinks. So that's step number 2. And then from there, it goes into the duodenum, the small intestine. That's where it's supposed to have things like bile, and then the pancreatic enzymes sort of dumped into this food slurry that unfortunately is not a slurry in many cases by the time it gets there. And then from there it goes down into the rest of the small intestine, where the majority of the absorption of nutrients is supposed to occur. And again, if it's not been well digested, it's really difficult to absorb much out of that. And then from there it goes into the large intestine, where really the chief thing that happens there is fermentation of resistant starches, vegetable fibers, things of that nature for the good bugs that live in the GI tract. And then for the actual pet, they're just absorbing water from the stool at that point. So if we think about that digestive process and we think about the steps that can go wrong, yes, that can create GI symptoms, vomiting, nausea, diarrhea, things of that nature. But the difficulty is that it can also create itchy skin. It can create asthma symptoms for cats. It can create, the ability for cancer cells to go undetected because the immune system is not functioning properly. So all of these diseases that are chronic in nature, essentially any disease with itis behind it, arthritis, dermatitis, gastroenteritis, hepatitis, all of those things, and granted hepatitis can often have an infectious component to it. Any of those itis diseases occur because there is inflammation happening. And so when our GI system is not able to help combat that inflammation, chiefly because the probiotic organisms are not able to the good guys aren't able to come in control over the bad guys, then all hell breaks loose, if you'll pardon the expression. And that's where symptoms start occurring, and you can't get them under control. And you take some medication, for skin disease, we give these guys steroids to help reduce the itch and the inflammation, which is one of those things. It's great in the short term, but the long-term result is that we still haven't fixed the root issue. And in fact, with the medications, we've made it somewhat worse because typical course of veterinary treatment is throw this dog on antibiotics and steroids so the skin infection and the itchiness slow down. Well, what we've done is just annihilate the probiotic population in the gut so that the good guys are going to have a heck of a time getting back in control. Again, so if we've got something like 13 trillion organisms to overcome, and we're throwing in, a probiotic which will help to some degree, but it's at a 5 billion colony forming unit dose versus something like a more high-powered 100 billion colony forming unit dose. It's going to take a long time to have an effect. The other thing that's equally important is to use a diet that's high in fibers, high in easily digestible meat, and low in processed foods. So if you look at many of the pet foods, there are things in there that you just cannot pronounce. And I have a heck of a time doing it. So that's your first clue that that's a food to avoid. The other things you're going to see in there are, wheat middlings, I think, are passé. They're breaking wheat and corn and everything else down into even smaller and smaller particles that fill a particular nutrient niche. So we think of corn as a carbohydrate, and it is, but it's also got a fair amount of protein in it. But they can break it down into these little bits and pieces. So if we need to bump up the the simple carbohydrates without adding protein into the diet, then they can use this particular processed piece of corn. But the thing is that that's not normal, and that's not what your body would be presented with normally. So that's where diet is so very important. We have to offer these guys things that are going to help those good bugs, those probiotic organisms, thrive. And so high fiber, if you just cannot cook to do the crock-pot diet, then what I would suggest is get the highest quality dry foods you can find, or canned food would actually be better because it's already moist and much easier to digest. And pick some frozen vegetables. I've often said to my clients, use Normandy blend because that includes broccoli, cauliflower. The brassica species are so important in good digestion as well as detoxification. And then some squashes, so that we're getting things into the body that those bugs need to live and to thrive. And so that's the deal, is that there's the ideal and there's what's going to get carried off, but that's a good first step. The other thing that is so important is actually using a probiotic supplement, and many of them come packaged with some Inulin, which is a prebiotic. So we've got kind of they're called combo products. And that's what Probiotomax is. It's a very high dose probiotic. It has Inulin as well as another polysaccharide in there to help feed the bugs so that they're going down into your gut with a food source. And then, for some of these guys, we'll recommend using a prebiotic. We do have to be a little bit careful, though, because if this animal has been suffering with GI issues, prebiotics can often be very difficult to onboard, and we have to start very slowly. So that is just an imperative supplement for everybody. We're in an environment where there's so much junk in it that we simply can't get away from it. So for instance, DDT, which is a pesticide, was banned in the United States of America in 1968. Yet today, babies are being born with DDT in their cord blood. And so how does that happen? So that's one, I use that as a survey example to tell you that we are all still exposed to that pesticide, plus many others. And so it turns out there's two and probably more mechanisms, but the two big ones are that DDT doesn't break down. And so it's in the air, it's in the water, and it just keeps getting recycled through the environment. The other issue is that with our world economy, DDT is not banned in Mexico or Honduras, where many of our vegetables are produced. And so we import vegetables from these countries because it's often less expensive to have them produced here and shipped to America than it is to have them produced in California or Florida, which are kind of our two big farming states for things like peppers and tomatoes and things of that nature, because their climate is much more amenable to it. So that's how, so we import these organic vegetables, but the problem is, again, DDT is still legal to use in Central and South America and Mexico. So it's still in the air and the water and the farm next door. And so that's how we end up with it continuing to be an issue in this country. So those are things that are not going to go away. But that's, again, where gut health becomes very important, because, as I said, first thing that happens in the gut is digestion and assimilation. The other thing that the gut is responsible for is the vast majority of the detoxification that occurs in the body. So the liver does a lot of work, but if the gut's not working well, the liver gets overloaded and it is unable to do its job any longer. And so then we have all these nasty chemicals that are just circulating through the liver, into the gut, into the liver, into the gut, into the bloodstream, into the liver, and just on and on and on, and we can't get rid of them. So that's why if we can get gut working well, it can assist in the detoxification of the body, because the good bugs are able to help break down these chemicals into a form that's safe to pass out of the body. So remember last week I was, if you will, talking about phase 1 and phase 2 detoxification within the liver. And I said that phase 1, so here's this nasty chemical, and it comes into the liver and it gets turned into something else through phase 1 detoxification. Well, that something else can often be more toxic than the original chemical. And then the issue is that if we're in this situation where the detoxification mechanisms are not working well, so i.e. phase 2 is way overloaded, then the stuff just keeps circulating through the body. So from the liver it gets excreted into the bile, from the bile it goes into the small intestine, and it just gets reabsorbed from the small intestine back into the bloodstream, where it travels all over the body and then ends up back in the liver. And so this is partly how a lot of DNA replication errors occur, and it's considered to be one possible mechanism for the development of cancer, because this stuff is circulating around and the rest of the body has no idea what to do with it, and it's doing damage to individual cells and causing them to screw up when they go to make a replica of themselves. So that's the huge thing. If we can support the gut and improve digestion and assimilation and detoxification, then at the end of the day, we're actually going to improve inflammation as well, because we've taken out of circulation, that's starting to sound like a little song or something, we've taken out of circulation all of the junk that's going to create these secondary diseases. And the other thing is that if we've got all these processes working, then that's going to prevent us or our pets from developing leaky gut syndrome. And so again, the idea with leaky gut syndrome is that things are just not working right. And once the bad guys get to be in charge in the gut, they start doing things like literally, if you think about your high school biology class where they talked about the villi, the finger-like projections in the intestine. So there's all these folds in the intestinal wall, and this is where we're supposed to absorb our food as well as water, and where all the finer points of digestion happen. Well, on each of these villi is a whole nother set of these little finger-like projections. And so that's how something that's 16 to 20 feet long ends up having the surface area of, I think it's 2 tennis courts, because there are so many folds. Well, these things that we're supposed to be getting rid of that we're not getting rid of, these toxic metabolites, they actually just kind of kill the villi. And there are electron microscope photographs of, here's normal and here's the clubbed off, eaten up villi. So A, you're not going to be able to absorb food very well. And B, this is where leaky gut syndrome starts. And so what that means is you've got all of this surface area that's been taken away, and what's left, the cells are inflamed, they're angry, they're not functioning well. And what's supposed to prevent us from absorbing all of this yucky stuff into our bloodstream and down into our immune system is that between each of the enterocytes, which are the intestinal cells, there are these tight junctions. So literally, they look something like this. And so when things are all happy and nice, this is what happens. Nothing can get through that gap. But with leaky gut syndrome and inflammation, what happens is they separate a little bit. And now partially digested food goes straight down from inside the intestinal lumen, which is not sterile, to the immune system, which sits right underneath the enterocytes. And so that's part of how we develop food sensitivities and begin to react with an allergic type reaction to stuff we shouldn't be. So the example I always give is the vast majority of pet food is corn and chicken. And so every time your pet eats, it's eating corn and chicken. And as this leaky gut syndrome develops, every time it eats, corn and chicken in undigested chunks are going straight to the immune system. The immune system begins to see it as an antigen or something foreign that needs to be destroyed. And so every time your dog eats corn and chicken, it has an allergic response and an immune response. And sometimes that immune response is at the GI tract, but often it can be elsewhere. So the dog that has dermatitis that's responsive to food changes, that's because you're taking away that antigen it's been seeing for the last 6 years of its life. And now there's something that it doesn't recognize, the immune system doesn't recognize, so the symptoms calm down. So that's huge. And, on the human side, we're able to test really clearly for so many food allergens. One of the few food allergy tests that are available for veterinary patients, for dogs and cats, is NutriScan through Dr. Dodd's lab. And it has its benefit in terms of being a good guide, because she does test for different types of immune components so that you can see, is this because it's truly allergic to this type of food, or because it's sensitive to the food and it's developed an immune response to it. And so that's helpful in forming a new diet for this pet. But ultimately, if you leave that pet on that same food every day for the next 6 years or 2 years, in many cases, they're going to get sick again and redevelop the symptoms. And so that's why rotating foods is so important. And I've been through this myself personally. I've had some major GI issues over the year. A decade ago, I was able to do one of these food sensitivity tests and go through what's called a rotation and elimination diet. And it's a pain in the behind, because it's all the stuff that I didn't really want to eat. So everything that I was eating on a regular basis is what I was sensitive to, which is no shock in retrospect. But the rotation and elimination diet was to take foods that I had low reaction to, and they were divided into antigen sets that were going to be similar. So day 1 was the first set of foods, day 2 was the second set of foods, and day 3 was the third set of foods. So in my gut health program, I've set up a way for you to be able to do this rotation and elimination diet simply by figuring out what your pet's been eating for the last 6 months, and that includes what you're putting in the bowl as well as treats, and develop recipes for so that you've got 3 different sets of antigens to feed on a rotating basis. And the gold standard on the functional medicine side used to be 6 months, and in some cases that's still necessary, but sort of down and dirty is to remove all of that for 3 weeks and then reintroduce it gradually to see what you do and don't respond to, which is, there's pluses and minuses to it. It is difficult to carry off a rotation diet for 6 months out of whack. I can't argue that. It's much easier to actually do that for a dog because they don't go out to eat, so they don't have the challenges that we often face. So that's kind of why gut health is so important. It is the cornerstone of health. If your gut is not healthy and happy, ain't nothing else happy. So that's what I got for you today. I'm going to put, we'll put some links down for probiotics and all of that, but that's why I keep hitting home on this message, because it truly is the cornerstone for health. So I hope you guys are doing well. I'm going to see if you've got any questions, and I'm not really seeing any pop up unless I'm not very smart today, but I think I'm good to go. So that's what I know for today. If you've got questions, please message me on Facebook, email us at support@theoriginalcrockpetdiet.com, and then on our website there's a form you can click that says Ask the Vet, and that'll get a question to me as well. So hope you're having a great day. Enjoy, and think hard about gut health. Remember, your pet's best health truly does start in the bowl.